Hi, my name is Dr. Kevin Millet, and I am excited to invite you to join me in a kind of a very special event. It's a TBM Master Series program that I will be presenting, going through how I, when I was in active practice, integrated laboratory scientific medicine with energetic medicine. There seems to be this myth out there that either you do energy medicine and you're unscientific, or you do scientific medicine, laboratory, objective evaluations with your patients, and therefore you don't do energetic medicine. I personally have received over 500 hours postgraduate training in diagnosis and laboratory medicine, electro-diagnostic testing, and so forth. Had an experience that really has shaped the way I approach healing and approach really healthcare in general. And that occurred back in 1995 when my then 3-year-old daughter, Nicole, had a fever for several days. Got up to 106.5 for about a day and a half or so. She'd stopped eating, she'd stopped drinking water, and I was, obviously concerned that she was getting dehydrated, and we were doing everything we could. This was before I was in TBM, but I, of course, was a chiropractor at the time and had a fair bit of knowledge in herbal medicine and such, of course, nutrition. And so we were doing what we could to kind of, address the situation really on our own. But over time, it became apparent to me that it was really no longer safe to keep her at home. I contacted a few associates I had that were pediatricians, and they said, "You've got to get her to the hospital." So very, very reluctantly, I took my 3-year-old daughter, who had never been vaccinated, was born at home, had never had aspirin, Bactine. We didn't even use teething rings, cold ice teething rings. No symptom treatment, raised very just in healthiest way I could. Because we get to the hospital and the first thing they do is put her on antibiotics, and I cringe and I wince. I'm like, okay, I brought them here, obviously, because I need their help, and so I had to extend some trust to them. Turned out that saved her life, because what we were confident of by the next day, that she had common acute lymphoblastic leukemia, and essentially she had a hematocrit that was in the single digits. She had virtually no white blood cells and virtually no platelets. She was getting a petechial rash around her eyes and the folds of her arms, which I really missed and didn't know how to interpret at the time with the training that I had. So I went to the hospital, they recognized those things. I ended up doing a bone marrow biopsy and sure enough confirming that diagnosis. The first night, a doctor by the name of Lemon, he told me that he suspected that she had leukemia, that they would want to begin chemotherapy right away. And having been in alternative medicine at this point for nearly 20 years, I recoiled at his suggestion of giving my daughter, who had never had any medicines, going right into chemotherapy. And he said, well, if you don't allow us to treat your daughter, we'll get a judge to sign an order, and she'll become a ward of the state and will completely exclude you. Of course, that was quite upsetting to me. We exchanged a lot of words. The next day, spent the night in the hospital. The next day, a new doctor was assigned. He said, "Kevin, I understand things didn't get off to such a great start last night with the other doctor. I want you to know that I've been assigned to your case, and the first thing I want to communicate to you, one, I realize that you care very deeply about your daughter, and two, I recognize you're a very intelligent man, I'm not here to force you to do anything with your daughter. We're not going to do anything that you're not comfortable with. But what I do ask is you take a look at our protocol and what we have to offer. Because I think when you do, you'll come to realize that it's the very best thing that could be done for your daughter. I did just that. I, of course, didn't go back to my office for days and days while she was in the hospital. I just lived at the hospital, spent time in their medical library, and I was determined to know as much about common acute lymphoblastic leukemia as Dr. Carroll did. Now, I couldn't know everything that he knew in a broad sense, but I could do a crash course and really understand common ALL quite well. And I think I succeeded at that, and I was able to go back with him after having reviewed the research. I'd always had this bias against any cancer treatment. And I'd said for many, many years, if I ever had cancer, I would not go the Western route. And I discovered, upon looking at the research, that a once near death sentence of lymphoblastic leukemia for a child, that great strides had been made, and that through research, trial and error, experimentation, they'd actually gotten the survival rate quite high. So I was impressed with that. It really kind of took me off of my high horse about how superior alternative medicine is and how horrible Western medicine is. And because of the research, I was able to understand how it would apply to my daughter's situation. And we had conversations, and we worked together, and we made changes in the protocol. Changes he was comfortable with, changes that I was comfortable with. And we ended up having a very, very positive experience, and of course a positive outcome. She's now a mother and doing phenomenally well, and she went through the treatment program doing great. And I left that forever changed. I realized through that experience, because I blended alternative medicine. Mostly at the time it was chiropractic and herbal medicine and diet and other nutrition, probiotics and things like that, together with what was being done with pharmaceuticals. And we had a really, really positive outcome. And I came away from that no longer afraid of scientific medicine, no longer afraid of interacting with those who came from a scientific medicine background. And it forever changed the way that I approached patient care. I had another experience not long after that, and that is I ran up the stairs at my home, and I got to the top of the stairs, and I was breathing heavily, just the way I'm breathing, how I got winded. And so I ran a lab test, and sure enough, I had anemia. And I addressed it, and things completely changed. I thought, well, gee, I wonder if some of my other patients have anemia that I've been working with that have had some of these symptoms. I tested their blood, and they did. And I was hooked instantly. I realized how helpful it was as a clinician to know up front what I'm dealing with as far as a particular case goes. And so I developed over time an increasingly comprehensive and expansive list of diagnostic tests that included lipid panel and CBC and complete metabolic panel, but also included arthritides and viral panels and autoimmune testing and urinalysis and testing the hair for mineral analysis and the urine for toxic metals, doing provocations with DMSA. I measured heart rate variability. I did MRIs on the majority of my patients. If there was an indication on X-ray that there was any disc degeneration, I would do an MRI. Of course, the physical exams, neurologic testing, and nutrient testing and pH testing. I was testing salivary pH, gastric pH, stool pH, blood pH, and seeing what diet did. And so I really immersed myself, and I worked with more and more challenging cases I went to LabCorp, who was my lab service provider, and I said, I want to negotiate with you to get a lower cost on these panels for my patients. And so I just wanted to put it all into one panel and this is what I will do with every new patient. They said, okay, great, give us your list. I gave them the list, and it took a couple weeks for them to get back with me. The sales rep finally came back, and he said, we got your panel approved. Like, okay, great. Wondering why it took so long. And he said, well, it's because we had to go to the home office in Chicago, and it had to be approved by one of the executives there because it was the largest testing panel that LabCorp had ever approved for any physician ever. And that's when I realized I was doing something maybe a little special. Truth between you and I was maybe over-testing a little bit, but I was getting to know testing. I was getting to know how they interplayed with energetic medicine. And so it was important for me to get this whole picture. I called it a mosaic. I would take all of my test findings and put them in a spreadsheet, and I created ranges, and if something went out of the optimal range, it would go yellow, and if it went out of the clinical range, into the pathological range, then it would go red. And I would go over this with my patients. So I got a lot of experience. Something else very important happened in this process. When Viktor Frankl died in 2009 and TBM, or 2010, and TBM rested on my shoulders, I realized in that moment that it was really important that I had a very high level of certainty about what I was doing, that I was now the public face of total body modification. I was going to be challenged by students, maybe challenged by courts, maybe challenged by medical boards, and I realized that I had the confidence needed to do that. I'd always seen Viktor have that kind of confidence. Those of you that had a chance to hear him live or have watched some of the recordings of his videos know that he spoke with absolute certainty. And I realized that I had gained through this laboratory process. I had seen before and after of all of these tests, and I'd seen these, antibody or autoimmune indicators clear, infectious indicators, and normalization of the CMP with the transaminase that organ inflammation was calming down. And I got to see all this, and it gave me a sense of grounding and gravitas and conviction that really helped, not just in communicating with the lay public who were my potential patients. I developed an interest in becoming a full-time medical researcher. And so I began that process. I needed a sponsor from a university. And so I went to the University of Utah, and I went up really with trepidation, thinking, gee, these researchers are just going to laugh me out of here. They're going to say, you're a chiropractor, you don't have a real degree, you're unscientific, go away. But I really wanted to become a researcher, so I overcame my concerns and met with Dr. Chapman in the beginning, explained what I wanted to do. He was very welcoming to me, and he referred me to one of his associates that he thought might be more suitable to help me, through this process. And he said, one of the things I would invite you to do, just to get a feeling for our research community here, is we meet and we share our research every Friday morning in what we call our didactic lectures. And you can come and allow you to meet other researchers, and I think it would be a big help to you. So I started going to those. They started at 6:30 in the morning, so it made for an early Friday morning. And I immediately just fell in love with them. I loved hearing new research projects. As you know, it can take years before things actually get published, or even to discover things that have been published. We don't always find them as soon as they come out. So I was getting all this fresh information, and at the time, specializing in fibromyalgia, University of Utah leading the way in many areas with fibromyalgia, specifically as it related to hormones. And so I was really enjoying this, and they asked if I would present. And that scared me a little bit. And I thought, well, okay, what do I have to lose? So they wanted me to talk about fibromyalgia. I was at these presentations, 12 to maybe 20, 22, something like that, they would attend. You know, it's early in the morning. Not a lot of people like to get up that early. And I thought, gee, you know, when I go, there'll probably be like 3 people there. Dick Chapman will probably come support me since he's the one that asked me to do it. And I thought I better invite a couple friends just so I have someone to talk to. And I went to present. You know, they send out their email and put up notices, so they advertise a little bit. And it was standing room only. In fact, people were down the hallway. There was close to like 40 people, by far the most that I had seen. And I was just floored that all of these researchers and research-minded physicians actually wanted to hear what I had to say. And I only got about a third of the way through my PowerPoint presentation, and I just got deluged with questions. And I realized from that experience and with some of the relationships, you know, that came out of that, that the research community is actually, by and large, where we are. They realize the value of energy medicine and the alternative perspective and lifestyle-based medicine and so forth that we bring in TBM. And I came away realizing that in my mind, this imaginary conflict that I had constructed between alternative energetic medicine and Western or scientific medicine really didn't exist. That laboratory and scientific medicine and energy medicine really dovetail beautifully. If you know much about the early days of TBM, TBM's foundation was in diagnostic and laboratory medicine. How did that happen? Well, Viktor Frankl practiced in Pasadena, California. And Pasadena, California also hosts Jet Propulsion Laboratories. Viktor had a lot of patients that came from JPL. Well, one of them was so impressed with Viktor's results and saw him getting results that he had never witnessed another provider be able to deliver, and asked Viktor if he would take part in a special project to create a wellness program for astronauts. And so Viktor said sure, and he and his co-founder of TBM, Harold Havlick, they teamed up with 2 medical doctors and started to put together a wellness program. Well, what they found is some of the points that they were using were inaccurate. They would run diagnostic tests on several people there at JPL and clearly find out that all these people had, I'm just going to make up an example, but all these people clearly had a gallbladder problem. But when they tested the gallbladder point, only half of them tested with a positive gallbladder point, the other half didn't. And so they went to work to find and develop a gallbladder point that actually picked up 100% of the cases, and an adrenal point, and the heart point, and the valves, and the arrhythmia. And so they actually used diagnostic tests to make sure that the points they had were actually picking up the problems. But the second thing they did, as you know, there's corrections that come along with body points, and they would then make corrections and then look at the diagnostic tests, the respiratory tests and EEGs and EKGs, everything they had, and see if it actually corrected it. And if it didn't, they would go back and retool the correction, and that's why TBM, it's such money in the bank, if you will. It's so dependable. To a great degree, that's really what I did in my practice as TBM continued to develop, and I would use testing to validate the progress. So I was making sure that my patients weren't just getting symptomatic results, but actually physiologically, biochemically, structurally, we were seeing the changes in all the exams. This is what I want to share with you because it makes practice so much more interesting, and it's great to stand in front of people with confidence, and it brings this, and it's not that hard to integrate some testing. Now, you may not choose to go to the degree that I did, but with some familiarity, you're going to pick and choose, and it's going to make you a better provider, a better doctor. It's great to know up front, this is the long list of issues that we're up against with this patient. It allows you to gear their expectation, gear your approach and your program to make sure that those things all get addressed, they get addressed quickly. Because one of the things I found out is sometimes I would labor with the patient for 3 months, get minimal results, finally do a specific test, gain new information from that test, and then a week later, it's handled. And I developed this idea of, well, why not just do the tests up front and not waste 3 months? Bring your own lab tests in for yourself, and I'll interpret them, and we'll talk about your health picture, and also an additional patient, so someone you could choose from your practice or a family member. So most of the 18 hours of the Master's Series is going to be really just looking at test results and applying them straight to a clinical situation, applying them to different TBM body points and different TBM tests and programs and vials and things like that. So I'd like to end with inviting you to join me March 18th and 19th for our new Master's Series that I will be teaching, titled TBM Diagnostic Testing and Advanced Backward Thinking. Love to have you join us here in sunny Las Vegas, and I'm guaranteed to be a very enriching experience, one that will impact your own health as well as your ability to really be a gift to those who entrust their health and their life in you. Thank you for your time.